My name is Tabor. I'm with J. Marie Skin Studio. I am a licensed esthetician and a certified laser specialist. Today, I will be doing a skin tightening laser facial. What this will help do, it will induce elasticity and collagen, as well as take away any type of hair, pigmentation, sunspots, and cherry angiomas that you might find in the surface. First, I will begin with a double cleanse, and then I will allow the skin to dry, and we will begin the treatment. While I'm allowing the skin to dry, we will all get our eye protection on. The reason you need eye protection is because we need to protect our eyes from the light frequency that comes from the laser. Her skin is dry, so we will begin. As I'm going through the laser facial for skin tightening, what I do is I overlap each little circle to make sure I am covering all areas of her skin. As I'm going through, I do see some sunspots on her skin. This will help darken those right away, and then eventually they will fall off, kind of like a scab. Any type of unwanted dark hairs that she has throughout the skin, those will also be zapped off. As I'm going through this treatment, you definitely want to avoid the eyebrow area. We don't want to send our clients out without any more eyebrows. It is okay to line them. You definitely don't want to go over them. You would like to go as far up on the forehead as the hairline. She does have some lighter hair, so it's not going to attack those. She will be safe around the hairline. I will cover the whole area of the forehead, and then we will move on to the cheeks. What this is doing is it's creating little micro injuries to the forehead. And what that is also doing is sending elasticity and collagen to the surface to repair. And naturally, that plumps our skin. My model will not have any downtime. Right away, she will be able to get right back to whatever she does on a daily basis. The only thing I would recommend her steering clear from for the next 72 hours would be working out. The reason being is you sweat when you're working out, and that can inflame your follicle. Inflaming your follicle can create a type of infection. As I'm going over the forehead, I do notice she has some enlarged pores, and that's wonderful. What this will help do is it will help close those pores up and bring them back to normal size. As I move on to the cheeks, I can already tell she does have some telangiectasia. This treatment is wonderful for telangiectasia. What I do is I will start from the inception, which is the beginning of the telangiectasia or the broken capillary, and then we will move forward. As that's happening, it will create a little bit of a darker area, and then they will end up vanishing. Post-treatment, she will not want to use any type of retinol for the next week, just in the sense that your follicles are a little bit upset. It's trying to repair from the bottom up, so we want to make sure that we're treating that correctly. For laser facials to achieve the results that you're wanting to, depending on the severity of any type of telangiectasia or pigmentation, you can need anywhere between 6 and 12 treatments. For my model here today, I would say she probably needs anywhere from 6 to 8. She does not have terrible telangiectasia. She does not have a lot of dark hair. If a client has had fillers or Botox in the last week, you would like to push out their laser facial treatment just to make sure the fillers and the Botox have set. To become laser certified, I had to go through 132 hours of classroom time, along with working on models, learning the devices, learning the different wavelengths and frequencies. There's a lot of different lasers out there to make sure that you are understanding the frequency. Throughout my training, I had to have models for every single laser that I had learned, along with every different treatment, whether it was laser hair removal, pigmentation removal, cherry angioma removal, and spider vein removal. Contraindications for this treatment will be pregnancy, cold sores, sun exposure, and self-tanners. Now that we've finished the facial skin tightening laser treatment, I'm going to move to her chin, neck, and décolleté. The reason for that is we cannot have just the face completely tightened without doing the rest. A lot of people do forget about the neck and the chin and the décolleté area. I feel it's very important. Here we will find a few different things that we might not find on the face, including cherry angiomas, skin tags, and different pigmentation. This laser treatment does not help hypopigmentation, it helps hyperpigmentation. There's a big difference, and I feel that's very important that people do know that. Again, we will put on our eye protection. She already has hers on, and we will leave them on. As I move from the neck, I'm going to go to the décolleté. Here I do see that she has some cherry angiomas, some freckles, and also a skin tag. Please remember that this laser does not take care of skin tags, so I will be going around it. It is possible for clients to have broken capillaries in their décolleté as well. So I will treat those just like I did on the face. Start from the beginning and go to the end. They will get a little bit darker, and then everything will end up lightening up over time. When treating cherry angiomas, it will spark a little bit. It will be a little bit spicier for the client per se. What will happen with that is it will get darker, and then it will also flake off. With cherry angiomas, you need in between 4 to 6 treatments typically, unless they are quite large. And as you're going through your client's skin, please make sure you're keeping an eye for any type of indication that might want you to refer them back to their dermatologist. Having a great cross-marketing connection with a dermatologist can be beneficial in all ways. As I'm going over her décolleté, I do see some enlarged pores. Immediately, I'm watching them shrink. If the client does have any moles around the area that you are treating, please work around them, just like you would skin tags. Now that we have finished the skin tightening laser facial, I will be applying her finishing products. First, I will do a hyaluronic collagen booster. What this helps with is reducing any type of fine lines and wrinkles. And since I've created micro injuries on her face and her neck and décolleté, this will help promote the collagen and elasticity booster. Next, I will apply an intense recovery cream. What this will help promote is any type of cell turnover and boost within the next couple hours. It will help reduce any redness, any inflammation, as well as start promoting the cell turnover as well, like I had mentioned earlier. And now I'm applying a sunscreen of 44. The reason I am applying a sunscreen is because I did an exfoliation treatment. You never want to send your client out the door without any type of sunscreen. Please check with your state regulations to make sure you're sending them out the door with the proper SPF. And then to conclude everything, I will be applying a lip balm, which also has sunscreen in it as well. So post-care from after this treatment, you will want to make sure she does not go tanning. She cannot go tan outside. She cannot go tan in a bed. I would prefer that she did not do any type of self-tanners. All of that would be for the next 2 weeks. Please make sure she's not working out within the next 72 hours. It can inflame the follicle in the pore, which will create an infection. I would also recommend that she steers clear of retinol for the next week. Reason being is it could really inflame her skin. Thank you for tuning in to this skin tightening laser facial technique video. We hope you enjoyed it, and I hope you have a beautiful day.